My name is Alyssa Rayborn, and this is Deliverable 5. We are going to start with the comprehensive physical exam. And in order to get started before the exam, there are a few items that we need to ensure a thorough exam. Some of the tools that you will need during this exam include an ophthalmoscope, otoscope, pen lights, possibly tongue depressors, thermometers, a watch with a second hand, a blood pressure cuff, stethoscope, reflex hammer, and tuning forks. I have some of those items. I will not have all of them, so I will just say those out loud when it comes time to do that assessment. The next step, aside from gathering your tools, is to wash your hands, ensure patient comfortability, obtain a set of vitals, introduce yourself, explain the steps of the physical exam to the patient. You want to ensure patient comfortability and privacy. Explain all steps involved in the process and follow a sequential order, starting with head and neck, moving down to chest and abdomen, and then lastly, lower extremities. Okay, we are here with Mr. Rayborn, and we are going to do a comprehensive physical exam, starting with him sitting. We're going to do a general survey just on appearance, cleanliness, overall inspection of the patient. We are also going to take a set of vital signs. We will presume that they are all within normal limits. We are also doing a survey of his skin at this point, looking at color, warmth, any visual lesions or abnormalities. We're also going to do head and neck assessment at this point. So we're looking at ears, any ear issues, any ear hearing loss, ear pain. At this point, we would take our pen light and do a assessment of his eyes. We're going to say that his pupils are equal reactive to accommodation and light, so those are all within normal limits. We are also going to assess his thyroid. And to do that, we would palpate the thyroid from behind the patient. No swelling, no pain when I touch, no deviation noted. We would also assess lymph nodes at this point, the same way we would do thyroid. Make sure there's no swelling, no tenderness in your head to each side for me. Okay, perfect. Moving on to thorax and lungs, we would take a visual inspection of breathing. Everything is symmetrical, doesn't appear to be in respiratory distress. No cough, no cold, no symptoms, no congestion, no issues. Okay, so I'm going to listen to your lungs. Start from the front. A couple deep breaths in and out for me. Thank you. In and out. Okay, thank you. Very long, deep breaths. Okay, under here. Into the right middle lobe. Deep breath in and out. And do once more this way here. We move to the back. Same thing, we'll just listen to your lungs from behind. I also will have my hands on his back and chest to ensure symmetrical breaths and no short, shallow, rapid breathing. Give me a cough. Perfect. All right. Are you a smoker?
No.
Okay. So moving on, we would move the patient into a position where he is 30 degrees, not completely supine. We would assess for JVD. I'm going to have you lift your neck here. Turn your head to each side for me. Okay. No signs of jugular vein distension. We would also listen to carotid arteries to assess for any bruits, which I will do now. Turn your head a little bit for me. And we'll also do this. Okay, turn this way for me.
Your arm's blocking it.
Thanks.
You're welcome.
Here, we'll do the bell with the stethoscope. Okay. While the patient is in the 30-degree position, we will also listen to cardiac sounds. We will go ape to man, And also we'll measure the apical pulse for 1 minute. So I'm just going to listen to your heart here. Let's see your wrist too. Put your arms down for me. I will also measure his apical pulse against his radial pulse for 1 minute. Any issues with hypertension, high heart rate? Nothing. Okay. Moving on, we would place the position supine to do the breast, axillary, abdomen, and peripheral vascular assessments. It's at this point we would visualize and inspect breast area as well as axillary lymph nodes. We would also palpate for any swelling or inflammation in that area. From there, we would move down to the abdomen. We are going to listen to your belly. I'm going to lightly touch and tap, and then I'm going to press deeply on your belly, so you just let me know if you have any pain at any point in time, okay? I'm going to start with auscultating his bowel sounds, each quadrant. Bowel sounds are all equal, active, no signs of hyperactive or hypoactive bowel sounds. Any issues going to the bathroom, constipation, diarrhea?
No.
Okay. So I'm going to lightly tap my finger against your belly to assess for dullness, tympany, any signs of fluid. At this point, we would also measure the size of the liver and any organs underlying. So if you have any pain, just let me know. Okay, perfect. No signs of any fluid collection. Like I said, we would also measure the liver at this point. I'm now going to palpate your abdomen, so I'm just going to press a little bit deeper, okay, with 2 hands here. Let me know if you have any pain. At this point, we're assessing for any signs of rebound tenderness, guarding, any signs of pain, or protuberant abdomen. Any pain? No? Okay, great. While the patient is still supine, we will also assess the peripheral vascular system. So overall, we are looking to make sure all extremities are warm, capillary refill is good, less than 3 seconds, no signs of cyanotic fingers, toes, even the mouth, no signs of cyanosis. No obvious signs of lesions throughout the lower extremities here. This camera. I'm also going to assess pedal pulses at this point. So I'm just going to feel your feet here, measure your pulses in your feet. Move you over a little bit. There we go. Perfect. Okay. Can you feel me actually touching you? Any decreased sensation, any numbness or tingling, any pain? Okay. Also going to move up to here and do these pulses. Equal bilaterally. No signs of irregular heartbeat or heart rhythm. Brachial pulse, as well on this side. Perfect. While the patient is still supine, we are going to assess the nervous system, which includes motor strength, sensation, and reflexes. So I'm actually going to start, we'll do hands first. So I'll just have you give me a hand squeeze. Both hands. Okay. Lift your arms out in front of you. Don't let me push your arms down. Okay, those are nice and equal, no deformities. Okay, push down on my hands. Great, okay. Okay, thank you. We'll also do the same, move this, with his lower extremities, motor strength. So I'm gonna have you push down like you're driving a car. Great, pull back. Both are equal, no deficits. Another part of the neuro assessment right now is just to measure sensation, make sure that there's sensation in all 4 extremities, there's no deficits there. So you feel me touching you here, feel me touching you here, 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 okay? Any issues here? You can feel me touching you here? Perfect. At this point, we would move the patient to sitting on the edge of the exam table to assess range of motion, observe for any joint deformities, things of that nature. So actually, Mr. Rayborn, I'm going to have you just lift your arms above your head. Okay, bring them back down to your side. Perfect. Any pain? Any issues moving? Okay. Okay, I'm going to have you go straight up again with your arms down to your side. Now go straight up, not sideways, straight up. Yep, and then put your arms behind your head. Perfect. Any pain? Any issues? Okay. Okay, I'm going to have you put your arms behind you, your lower back, then back to behind your shoulders. Perfect. Any pain? Okay, great. So I'm going to have you put your arms at your side. Okay, straight out, straight back, place on your legs, palms down. Okay, great. So I'm going to have you stick your arms straight out. Okay. Sorry, we're back in frame here. I'm going to have you bring your palms back, down, up again, down, and then roll your fingers out and make a grasp, a grip. Perfect. Okay. Moving on in this section, we would test reflexes with a tuning fork, reflex hammer. We would check the patella area for reflex. We would also check the elbow as well. Also at this point, while the patient is either sitting or supine, I would do a rectal or genital exam, but we are going to defer that for this purpose. Any issues at all?
No.
Going to the bathroom, urinating, bowel movements? Okay, thank you. So it's at this point in the examination, if you forget any steps or miss any parts, you can go back, which I am going to do a further investigation of his head, his ears, his eyes, his nose, his throat. I do have a light, so I'm going to do that. So I'm going to have you just look at me. I'm going to visualize your pupils here. Great. Reacted to light. Also going to check in your ears here. Any hearing issues, pain?
No.
Issues with wax? Okay. No signs of fluid, redness, inflammation in the eardrum or ear canal. Okay. You can also do hearing tests at a comprehensive physical exam, which we are not going to do today. You look in your nose. Okay. Be assessing turbinates, any swelling, fluid, things like that. And then your throat. I do not have a tongue depressor, but at this point I would use a tongue depressor to tongue depress him while I am looking in the back of his throat to visualize. Say, ah. Perfect. Thank you. No issues chewing, swallowing, painful. Okay, great. So I've just completed the physical exam for Mr. Rayborn, and he was here for a wellness visit. We did some hand washing, introduced ourselves, asked if he had any questions or concerns about why he was here. He did not. He denied any issues. So starting system-wise, neurologically, he was completely intact. We did a vital signs. All of his vitals were within normal limits. He was afebrile. His blood pressure was normal. Heart rate was 75, I believe. Afebrile, like I mentioned. No pain, no headaches, no neuro issues whatsoever, and was completely ANO times 3. I did assess his thyroid and his lymph nodes, cervical lymph nodes. No signs of swelling. Everything was within normal limits for that assessment as well. While moving on to cardiac, we did assess for JVD, which he was negative for. There was no signs of jugular vein distension. I also auscultated his carotid arteries. No signs of bruit. Heart rate and rhythm were equal. No heart murmurs listened to upon cardiac sounds. Denied any issues with blood pressure, chest pain, heart rate issues, things of that nature. Everything was within normal limit. His breast and axillary assessments were all within normal limits as well. Looking at his abdomen, we did visualize his abdomen. We percussed, we auscultated, we palpated. He had no pain whatsoever. He had equal and active bowel sounds on all 4 quadrants. Peripheral vascular assessment was within normal limits. Pulses were all equal. He had warmth. He had sensation to all of his extremities. No lesions, no ulcers. We did defer the rectal and genital exam for this portion of the comprehensive exam, but he denied any issues with bowel habits, urination, any sexual dysfunction, any issues whatsoever. Everything in that system was also within normal limits. We did go back and assess his, like I mentioned, his ears, nose, throat. Mucous membranes were pink, moist. He had no issues, no swelling, no lesions, no discharge, nothing out of ordinary for him. He denied any illness, injury, sick visit, anything whatsoever. He just came in for a well visit and had no complaints today.